What's really challenging now from a mental health point of view is the general health anxiety may go down, but the really hard issues, those related to unemployment, those related to social disruption, they've only just started. So what we now expect to see is a second curve of potential morbidity and premature mortality due to suicide, due to mental health problems, which is secondary to the unemployment and social disruption. Hi, I'm Professor Ian Hickie. I'm the Co-Director of Health and Policy at the Brain and Mind Centre of the University of Sydney. Welcome to a masterclass on mental health in the time of the COVID crisis. So mental health is a key issue for all healthcare workers. When the crisis started, everyone was anxious, and the most anxious of the lot were healthcare workers. Because really, just like if you'd seen what had happened in Europe and you'd seen what happened in North America and you see what's happening elsewhere in the world, and you're a healthcare worker, you had good reason to be extremely anxious. All the surveys that we have, the whole population was anxious. Nobody knew what might happen next and the risk of infection and what they should do. But healthcare workers in particular knew that they would be central and they'd be exposed to risk, perhaps risks they'd never been exposed to in their life before, and risks they'd never thought about for themselves, for their families, for their jobs, for their future. Very fortunately in Australia, 8 weeks down the track, the situation with regards to physical health now looks a lot better than it did. Not that we can take it for granted, but we appear to have the situation under control. We now have greater resources in health, we're better organised. So while there's a set of ongoing challenges, we appear now to be in control. And that's very important from a mental health point of view. It's very important to believe that you are actually doing what is necessary and you're not helpless, you're not hopeless, you're not being abandoned, that governments and others and the wider community really appreciates the role of healthcare workers. That's all very good for the mental health of healthcare workers. Now, of course, we need the healthcare workforce to keep turning up. So this crisis isn't going away in a hurry either, and therefore attending to the mental health, as long as the physical health of healthcare workers is really important. We really need a healthcare workforce that can cope and can continue to put itself in challenging situations, probably for the next 2 years at least, and know what to do, know what's the best thing to do from a personal point of view, mental health, physical health, and then the mental health and physical health of the patients and families we look after. And it's really that bit which I'd just like to concentrate on for a little while. General surveys of the rest of the population show how much their anxiety went up during this particular situation. Now, if you weren't anxious in the last 8 weeks, you're never going to be anxious in your whole life. I mean, really, your whole physical health, the economic future, the national future, the international situation has been up in the air. That causes anxiety. As time goes on, we already have data that perhaps the rest of the population is going, okay, it's not as bad as it could have been. But in relation to that anxiety, the rest of the population did some interesting things. One was stop going to healthcare, including people with significant mental health problems and with other quite severe physical health problems. So a lot of healthcare actual offices and organisations and hospital have been relatively quiet during this particular period. What will happen now is that people are more confident that it's okay to go to a hospital. Of course, what we're going to see is a return of the pent-up morbidity and potentially life-threatening situations. And we've seen that in mental health, just like physical health. What's really challenging now from a mental health point of view is the general health anxiety may go down, but the really hard issues, those related to unemployment, those related to social disruption, they've only just started. So what we now expect to see is a second curve of potential morbidity and premature mortality due to suicide, due to mental health problems, which is secondary to the unemployment and social disruption. In fact, at the Brain and Mind Centre, we published modelling last week that if the economic situation is what it is, at least 10% unemployment, we'll see a 25% rise in suicides every year for the next 5 years. And certain groups, those who are marginal, those who are casual workers, those who are young people, those who have less assets, those from non-English speaking backgrounds, those who actually just don't have the degree of social connection that others have, will be most affected. This is really important for healthcare workforces to know. There are groups that will really need our help. Whether you work in mental health or not, if you work in any healthcare organisation, there are going to be people coming to care who are really stressed and really under a lot of difficulty because of their wider economic and social situation. Interestingly, it was just reported last week about a 40% less expenditure on personal health care. People have stopped spending money on their health care. If they lose their job, if they lose their business, if they're actually a student who can no longer get casual work, they're actually going to stop taking care of the rest of their health, along with the mental health challenges that run with it. So the really big challenge in healthcare from now on may well be in the mental health area. So we need everybody who works in healthcare to be two things. One, know your own healthcare. If you take care of your own mental health, you're much better at taking care of other people's mental health and knowing what to do. And understanding we're all vulnerable. You know, we have this idea that we're all resilient, and particularly in healthcare, we like to think, slightly supermen and superwomen. It won't go badly for us. Often we find out during these crises, due to either things happening in our own workplace or in our own lives or in our own families, guess what? We're actually more vulnerable than we think. And so if something happened to you or someone in your family, would you know where to go to get health care? Would you know what good mental health care actually is? Would you know how to help people, to get online, to find the right services, where to go to find out? So first think, myself, would I know where to go? My own family, would I be able to help those people? Now, once you've sorted that out, it's very personal, because what people find out very quickly in mental health is they don't know. They do know where to go and find an orthopedic surgeon. They know where to go and arrange for a gynecologist. They know where to go for a pediatrician. They don't really know where to go for mental health. And they also don't know what is good care. They don't know what's available in a crisis or for ongoing care. So first, find out for yourself and your own family. Then when you've done that, share that information with other people you see. You're going to see a lot of other people in other healthcare settings, in emergency departments, in clinics, in outpatient settings, in GP offices, anywhere, who've actually got significant mental health problems that have been precipitated by the economic crisis and the social crisis. And they are likely to grow, sadly, over the next 6 to 12 months. So you can also help with that, once you've worked it out for yourself, helping others to actually know where to go and be able to say to people, look, I know where to go. I help my family to get care. This is what we do. It's all of us in these situations. Because variously people are going to fall apart. They've never lost their job before. They've never lost their business before. They've never had their marriage split up before. They've never had to leave education in either high school or in university or in post-school training because of the financial situation that they now find themselves in. And when they develop mental health problems, they then get more disconnected. They're actually less able to find out from others. So knowing what's online, knowing what services are available, and knowing how to help people. And the simple act of saying, I can help you to get this kind of mental health care just as easily as telling you where to get physical health care. So we're going to have national advertising campaigns, we'll have 1-800 numbers, we'll have lines. But what healthcare workers say, people respond to. They trust healthcare workers to know what the system really is. What's good care, where to get it, how to access it. So finding out yourself from the various websites, from the various resources. We've produced various webinars in my own particular institution as part of this to provide more information. Feel free to access that information. Feel free to recommend that information. Whether you work in rheumatology or oncology or cardiology or pediatrics, don't care. There are other areas that really matter. One, for a particular example at the moment, is in obstetrics and gynecology. Guess one of the groups that's most disrupted? Having new babies. So mums who would normally have a tremendous amount of social structure around them are now giving birth in hospitals largely on their own. They're going back to family situations that are disrupted. Families can't get together. So that perinatal area, really big risk area at the moment. Older people in geriatrics who are more cut off from people than they would be. People not attending their GP in the way that they did. People not keeping specialist appointments. People stopping medication because of the mental health kind of situation. And then encouraging people, whatever area they're in, there are things that we can all do. Staying connected is the main one. Technology assists us. So we talk about physical distancing at the moment, but social connection. Helping people to use technology, to stay connected, not just with their friends and families, but staying connected with healthcare, using the new telehealth initiatives. Pointing out to people, we do have psychological services under Medicare. We do have services that are available. We have services that are increasingly online. We have ways through our primary health networks and other ways through our hospitals of getting connected. If you know that, you can share that. If you say it's okay to get mental health care, it's okay for me and my family, I'm helping people in my family to get that care, I want to make sure you get that care. Because right at the moment, good quality care matters. And although we've had a lot of awareness and raising in Australia, we have a lot of discussion, and I'm personally tied up with that and been responsible for part of it. It's great that we talk about it, but that's only the first step. Talking about it has to lead to an action. The action's got to be to engage. And then what you really need people is to get good care. Care that you'd recommend for yourself or a member of your family. That's the same care we need you to recommend and help direct for those who really find themselves for the first time. The way to make our own predictions not come true, the ones around suicide in the future, is to act now. And some of the best actions will be in the healthcare system. So if I can implore you to get involved, to think about the service system, despite the fact that historically it's chaotic and hard to manage, it's actually there, but actually assist people to use it in times of great trouble. Then we're all more likely to get through this together and hopefully make my predictions and that of my group about suicide untrue. Just like the virus predictions have turned out to be untrue because of the actions we took. Not because they wouldn't have been true if we didn't take action, but because we took effective action, they've been untrue. We have the same possibility in mental health. So hopefully together, and particularly through the leadership of healthcare workforces, we can achieve it. Thanks for your attention.